Seasonal affective disorder causes depression when certain seasons arise. It affects people worldwide, but with proper diagnosis, treatment can be found. Today, I'm going to talk a little bit about what seasonal affective disorder is, how it is diagnosed, and finally, certain treatment methods. So to start, what is seasonal affective disorder? Well, in the title, it already gives you a little bit of a clue about what it means, seeing as it is a seasonal depression that usually emerges in winter and summer most typically. Although a better definition of this was given by Vilnius University Hospital, which highlights just a more specific element of the disease. It stated that besides environmental risk factors such as day length and sunlight exposure, genetics and neurochemical changes in the brain also play a role in SAD patients, showing the disorder is heterogeneous. Which leads me into a more specific definition of this disease, starting with geography. Location can determine the severity of the disease, and the regions that are most commonly known for it are the far north and the far south. They are most likely to suffer from SAD, and this is usually related to the deprivation of light as well as vitamin D intake. And the second thing that I would like to address is the genetics. It is shown that seasonal affective disorder most often runs in families, and a study done by Genetic Home Reference found the results that 15% of individuals with seasonal affective disorder have a first-degree relative who also has the same condition. So now that we have a little bit of background about what seasonal affective disorder is, we can begin to discuss the diagnosis for it. So seasonal affective disorder is often confused with depression simply because they have a lot of the same symptoms, although I would still like to discuss some of these today. So the first most important symptom to look for is the feeling of depression that is often throughout the day, as well as you feel it or have noticed someone else being in these states of depression many days in a row. There are also things to look for such as low energy, difficulty concentrating, thoughts of death or suicide, change in appetite, and more, although these symptoms do seem to vary person to person. Although I'd like to take this time to say if you are experiencing the symptoms or have noticed someone else experiencing these symptoms, I do encourage you to either recommend or go see a healthcare professional, because if you have noticed this, you can diagnose it and then you can look for treatment, which is the next thing that I would like to talk about. So now that we have an understanding of what seasonal affective disorder is, how to diagnose it, we can now look at the many treatment options. Although this is a very difficult disease to diagnose as well as treat, with regular seasonal treatment, you will find alleviation from the symptoms of this disorder. So, the first treatment that I would like to discuss is called phototherapy, which is also known as BLT, although not to be confused with a sandwich. This treatment is used for milder cases of SAD, which typically occur in the winter or autumn. A patient is seated in front of a bright light, which is usually a fluorescent light. It is an antidepressant treatment mediated by optical stimuli. And the best thing about this treatment is that you can do it from the comfort of your own home. No hospital visit required. As well as you can do many activities while doing this treatment. You can read a book, you can exercise, you can play with your dog or talk to your family. Just as long as you are receiving that light, you will be finding the benefits of this treatment. The second treatment I would like to address is called cognitive behavioral therapy, which alleviates SAD as a whole while not just focusing on certain symptoms. And this is actually just the encouragement of everyday activities. So things like getting enough sleep, eating healthy food, exercising. All of this helps to alleviate stress, which is directly related to alleviating the symptoms of seasonal affective disorder. So now we know what SAD is, we know the diagnosis, and now you have a good idea of some of the treatments. And now with this knowledge, you can either help yourself or you can help others. Just a recap of the main components of this were: what are the signs, what are the symptoms, and what are the possible treatments? Many people suffering from SAD, both diagnosed and undiagnosed, with treatment can get the help they need, as well as find alleviation from this disorder. Seasonal affective disorder is a complex disease, but with a better understanding of the symptoms, as well as knowledge of the most at-risk individuals, we can start to help one another identify this sickness and then treat it. If you have any more questions about this disorder, feel free to reach out to me and I would be happy to answer them. Until then, thank you.